Hi, everybody. Good morning or good afternoon to you. We've got Fred online. Hey, Fred, how you doing?
Hi, Phil. Fine, thank you.
Good to see you. Well, thanks for joining us today, everybody. This is our second training session today in relation to the INSIGHT system. And this is going to be very different to the online sessions that we've run with you guys before. This is very much about the practicalities of how the system works, and it's kind of pseudo trading ready, so you can go to the clients and start helping them with their sales inquiries and likewise their technical inquiries. So today we're going to be talking about the workflows associated with the INSIGHT system. And my name is Phil Newman. I represent the marketing side of the business, and we're joined today by Fred Carpentiero, who's our CEO and also our senior demonstrator. So, hey, Fred.
Hi, Phil.
All right. So we're going to be going through the INSIGHT workflows first of all today, and then navigating you through all of the different devices, the component parts of the system, and then obviously showing you how the app works in great detail. But to give you some familiarity of the system, we have four parts to it, which are 3 hard and 1 soft, effectively. We have the 3D scanner, which provides a tridimensional image of the inside of the socket. We have the sensor or biosensor, which goes inside the socket and is scanned as part of the scanning process. And they remain in the socket while the patient is wearing their socket. And likewise, we then have the wearable, the device that then transmits all of that very important data from those sensors over to the app. So the app, as you can see there, is sitting on an iPad. It is an iPad-specific app, and that is being used by the prosthetists for all sorts of functions, which Fred is going to talk us through today. So everything about INSIGHT is really about efficiency and bringing as far forward and as fast as it can be the workflow process. So I already mentioned the sockets and the sensors that go inside it. The socket and the sensors go in the scanner. Fred's going to show you that in great detail today. How the app works in terms of assisting with both the scanning process, but also how you profile the patient data that sits within that. And then obviously how the socket works once it's on the patient, and the real insights that are given to the patient and the prosthetist as part of that process. The feedback from patients has been very positive too. And as mentioned before, this is all about creating the perfect fit for patients and including the patients and the prosthetist is bringing them together into a faster process and workflow. So Fred's going to talk us through all of the system today. So Fred, I'm going to hand over to you, and I'll drive your slides, and then obviously switch out as you need during the session today.
Okay, thank you, Phil. Thanks everyone for joining. As Phil said, I'm going to talk about each of the individual parts, and on as much as possible, I'll try to demonstrate it on the actual device to make it easier to understand. So basically, starting by the scanner, it's a very simple device, as you can see, and there are 5 main parts in it. So you have the socket holder controller on the inside. So here on the bottom, you have the 2 buttons that control the opening and closing of the self-centering gripper. Then on the top, you have the camera laser assembly that will go into the sockets to create the 3D shape of the inner side of the socket. You'll have the socket holder itself, and then you have the main panel of the system that will give you feedback about how the system is behaving, and then you have the on and off button on the side. So very simple system, just 3 buttons to work with. Next slide. So on the information panel, you have the LEDs here. The first one is the network connection LED. So if it's a fixed blue light, it means that it's connected to the network and everything is okay. If this light is turned off, you will have automatically this one turned on, that is the warning sign, and it means that you have no network connection. When you turn the power on, you will see this light blinking. It means that the system is connecting to the network. The second button is the ready to scan, and you can have 2 states: turned off, which means the system is not ready to scan, in this case because the door is open, and If it changes to green, it means that it's ready to scan. So you can start the scanning process. The third LED, it's the scanning LED. So if it's turned off, it means that it's not scanning. When it turns on a white light, it means it's scanning the system. The fourth LED is the door LED. So if it's turned off, it means the door is closed. If it turns on, the door is open and you cannot scan. The final three LEDs are mostly warnings. So the first one is the need for calibration. So if amber LED is on, it means that the system needs to be calibrated and you need to run it through the calibration procedure. Then the other one, the next one means that there is a warning, there is something wrong with the system. Usually it's connected either to the network or the door being open. Those are the more common states. But if it's other problem, you'll get more information about it on the app. The last one, if it turns on a red LED, it means that you'll need to contact the support because there is something wrong with the system and it needs to be evaluated by someone from our team. Next slide. So just before using the scanner, some of some things that you should look out for before using it. It's make sure that the socket is within the size limitations of the system. If you're scanning a transparent socket, like a check socket, you should use a scanning spray before, because just make sure you get a very accurate system, 3D model, sorry. Make sure once you've placed the socket that this socket is in the correct position in the socket holder. So the socket should close it until the end. It will stop once the socket is properly centered and aligned, and ensure that the camera has a clear path to enter the socket and get out as well. Next slide. Previous one. So here I'll speak about these two slides at the same time, so that are related to the socket holder. So the socket holder can be adjusted for different heights and different types of sockets just by pulling this lever and moving it up or down and release it. It will have predetermined positions where you'll be allowed to stop. This is to adjust for the different heights of sockets. Once you have that adjustment done, you place the socket and then you have the two buttons, one to close and one to release. I can show you already with the socket. So place the socket inside, you close it, and it stops, means that it's now perfectly centered and the system can work. So if you press again the close, nothing happens. Press open and you can remove it. So next slide, I think we've covered it. Next. Okay, so on the scanner, that's all there really is. So as I said, very simple system, very easy to use. The rest of the system itself, it's controlled by the app that will go through in the end, since it's the more comprehensive part to explain. Now I'm going to guide you through the wearable and the smaller unit of the wearable that we call the IMU. Next slide. So the wearable has three different sizes, small, medium, and large, and that only means the number of strips that you can connect to the wearable. So you have the smaller one, you can connect 4 strips, the medium one, you can connect 8 strips, and the larger one, you can connect 12 strips. Next slide. So the device is flexible, so it can be placed around the socket, and it's silicone covered, so it's easy to use. You should use it with the logo on the right position, but if you need to use it downwards to make it easier to connect the sensors, you can also do it, because the algorithm will recognize where the device is turned. Next slide. So in terms of the the wearable itself, you have the USB-C connectors for the strips. You have the LED that will give you the information about the system, it's the status LED. You have the on-off button, the strap to put it around the socket, and the connector to charge, which is a micro USB connector. Next slide. So on the status LED, this LED can have different colors depending on the color that you give it on the app to configure the device. So this color is determined ahead, so you know which device you're pairing with if you have multiple devices on the clinic. To turn it on, you just press the power button. It will turn on and you'll see the blinking light because it's not connected. If it's once you connect it to the app to gather information, it will stop blinking. Turn it off, you just press again until the light turns off. The charging, it's micro USB, very simple. You plug it on. If it's charging, it will be an amber light turned on. If it's charged, it will turn off. Next slide. In terms of the location of the devices, it will depend if you are doing above the knee or a transcerebral or a transfemoral. If it's in any of the cases, the main unit of the wearable, that is this one where you connect the sensor, should always go on the prosthetic socket. The other smaller part of the smaller wearable, that is this one, should go on the opposite portion of the leg, meaning that if you're doing a transfemoral, this will go around the socket and this device will go on the pylon below the knee on the same leg. If you're doing a transtibial, this once again will go around the socket and this device will go around the leg above the knee. This will, and the reason for it is that each one of these has an IMU that will allow us to track the gait phases together with the pressure information. So next slide. Also important, the wearables should always be facing the outside of the leg. So it should always be on the lateral position. To charge, as I said, it's a micro USB connection, so very simple, equal to any mobile phone that you are used to. Next slide. So on placing and removing the device, as you see, there is a strap on the device. Just release it to give it some space, put it onto the device laterally, and you just tight it until it gets properly fixed. You can then connect the sensors very easily. They are USB-C, so you can connect them either way. They always work as it's more convenient. Then once it's done, you just release it and remove the wearable from the socket. So very simple, very easy to do. Next slide. You can jump. So the only thing on this slide worth mentioning is there is also a light on the sensors, and I'll cover this again once we talk about sensors. And that light is important because it will tell you the state of the sensor. So once the sensor connects, besides the click that you feel on the connector itself, you'll see a light blinking yellow, and that means that the sensor is properly connected to the device. Next slide. So now talking about the sensors. So next slide. There are 3 different sizes of sensors. So the difference in size is the length, and that is because of the number of cells that each sensor has. So this is the large one. It has 8 cells of sensors in the strip. The medium will have 6 and the small has 4. The reason for the different sizes is because depending on the transtibial or transfemoral socket that you're using, you might need to adjust the type of sensors you're using. You can mix them, you can use different sizes at the same time. There is no restriction around that. Each strip of sensors can only be used to 8 times, not because of the actual sensors, but because of placing and removing the sensors will make some stress to the connections that to get the data from the sensors to the wearable. And to make sure that the information is always reliable, they should only be used 8 times. Once those limit of times is achieved, there will be a constant blinking yellow light where we saw that the light that shows you that this sensor was properly connected. That light will not stop blinking, and that means the sensor cannot be used anymore and needs to be replaced. Next slide. So once again, on the sensor, you have first of all, you have the markers. These are the markers that allow the system to identify the number of the sensor that you're using and the type of sensor that you're using. So if it's small, large, or medium. Then you have the sensor ID that will also be identified by the system through the markers on the end. Then you have the vent. These vents should be placed ideally outside the socket to have more reliable data. If it's not possible, you can put it inside, but ideally always on the outside of the socket. Then you have the status LED that I showed you that will show if it's properly connected and if it achieves the limit number of usages or not. Next slide. So as I told you, you can see here, that's the LED. If it's all is okay, you connect it to the wearable, it blinks for a second, and that means it's okay. If not, if it keeps blinking, means that you need to discard the strip and replace it for a new one. Next slide. So one very important thing about the understanding how to use the sensors, and this is probably the part that takes a little bit more time for users to understand, is that we are not showing absolute pressure information, or they are not only, and the pressure is not only being measured on the markers, it's being measured throughout the entire strip where you have cells of sensors. The pressure that we are showing is actually relative pressure, and the reason for that is that it's very difficult for the user to know if the absolute pressure they are seeing is good or not, because usually people will not have enough information for that, and it will also depend on the characteristics of the patient itself. So what we do is to use relative pressure, where we are showing in a format of colors the pressure in the location of the cell as a percentage of the total pressure inside the socket from all the sensors that are connected. So that will allow you to see the distribution of pressure, meaning that if you have a red spot, doesn't mean that it's bad, it means that in that area it has more pressure than on others. So if you're looking for a total contact socket, you should have equally distributed pressure around the socket. So you should have the red on all the same areas around the socket. Next slide. Just some more things to look out before using, just as in the scanner. Make sure you're not using repeated sensors. This means that you're not using the same size with the same number. Make sure you're not overlapping the sensors, because that you will have cross information, but the most critical thing is not to overlap the markers, because if you do that, the sensor that is covered will not be detected by the system, so it will be ignored. And make sure that the sensors properly adhere to the walls of the socket to make sure that you have the best 3D model possible once you do the scanning, and the best location for the sensors as well. Next slide. So on choosing the number of sensors, you can use anything between 2 to 16 sensors, depending on the size of the socket and the desired surface coverage that you're looking for, as long as you don't use 2 identical sensors, as I said before, with the same size and same sensor ID. Usually what we have seen the most is that on transceval, people use 4 sensor strips, and on transfemoral 8 sensor strips, and that allows you to get enough information. But if you want to have those strips on one front, one back, one on each side, and then there is an area that you want to look with more detail, you can add another strip on that area. There is no problem with that. Next slide. So this is an advice that we give to make the system easier to use and make sure you're not going through a process and have to do it again without any results. and that is to check if the sensors are still viable, meaning that if they have not achieved the limit number of usages. And to do that is very easy. You just turn on the wearable device and you connect the sensors to the wearable device. If the light keeps blinking, that sensor needs to be replaced. If it just blinks once, you can use it. And this will not count as a usage, so because you're not doing any acquisition, and it's a very easy way to ensure that you're not putting the sensors, scanning the sensors, getting the wearable around the socket, connecting the sensors, and then you see that one of the sensors that you used is not viable. So you need to replace it and to repeat the entire process again. So just ahead of doing that, when you choose the sensors, you connect them all and see if any is blinking. If no sensor is blinking, you can go ahead and do the process as usual. Next slide. So the sensors, since they are reusable for a certain number of times, they can be and should be cleaned, and that can be done with a disposable towel or cotton with alcohol. And usually you only need to clean the surface that is in contact with the patients, but if you clean also the adhesive layer, there's no problem because it's a silicone-based adhesive. So as long as you then leave it to dry, it will keep adhering without any issues. Next slide. The same with the socket. So you should always prepare the socket by cleaning it with a soft cloth and alcohol and let it dry for a while before applying the sensors. Just make sure that you have a good adhesion and that everything is well. Next slide. On placing the sensors, so they come with a plastic protection that I don't have on this particular sensor. You just remove it very easily, and then you get the sensor. So you can see that now it has the adhesive. As I told, it's a silicone-based adhesive, so it doesn't leave any residue. And then you just get it onto the socket, and you press it against the socket, and it will be in place. So very easy to do. You make sure that the outside is also adhered to the socket, and then you bend it properly around to make sure that you get the best borders possible when you get the scanning done. Removing is the same way, just pull it and they will remove. Next slide. So one thing that is important is, once again, make sure that the air vents are not blocked or inside the socket, ideally, and make sure that the markers are not covered. So try to avoid placing the markers on concavities or occluded areas. You can have sensors on concavities or relief areas without any problem, just not the markers, because otherwise they will not be detected by the system. The next slide. So now moving on to the app. So this is the most comprehensive part of today's presentation. So I will start by I'll go through all the menus and through all the features, and then in the end, I'll screen share the app screen and go through and do all those actions for you to see how easy it is to do. So next slide. So once you log into the app with your individual user login, you'll have the main screen. On that screen, you have the patient management information on the top left corner, where you'll have the name of the user, the name of the clinic, the button to log out, the button for the settings, where you'll be able to change the units, to change the language and other definitions, and a button to add or remove patients. Then below that, you have the patient list, where you'll have all the patients that user has access to, because you can have a group of clinics or within the clinic several users. So the person in charge, the clinical manager, will be able to select what type of access each user has. Then on the patient information, on the top right corner, you'll be able to see some patient information like the weight, the height, the type of amputation, the age, and the gender. And then below that you have three buttons. The plus and the minus are to add or remove entries. So to do new scannings, do analysis, or remove existing ones. And you have the history button where you'll be able to press and see how the patient has progressed throughout the time. And then the last part of this window is the bottom right, where you will be able to see all the entries from each patient and their status. So if you have complete, it means that you did all the process. If it's incomplete, it means that you only did the scanning and you did not gather any pressure data. You'll have always the date and the hour where that information was acquired. And also the type of amputation, because if it's, for example, a bilateral amputee, you might have analysis for the right leg and the left leg. Next screen. So to add patients, as everything on the app, it's very simple. So all the functions are iOS native functions, so it's very easy to use, especially for those that have contact with iOS devices before. You could just press the plus sign on the home screen. You'll have a pop-up menu where you'll be able to write first name, last name, to scroll to select gender and select the date of birth and save. And then the patient is created. Next slide. Once you created the patient, you can add a new entry. Once again, you select the patient, you press the plus sign on the right. You'll have a pop-up menu asking you to select the type of amputation. You just press the segment of the amputated limb and you press start and you're good to go to start scanning. Next slide. On the patient history button, as I told you, you press it, the history icon, and you'll be able to see a history screen that will show you how the range of motion, how the weight, and how other information have been progressing throughout the time. Once you press start scanning and you select the type of amputation, you'll go to the scanning screen. On this scanning screen, on the top, as in any other screen besides the home screen, you'll have the navigation entry, where you'll be able to move back and forward through the processes. Then on the left side, you have the tools, the feature menu, where you'll be able to select the type of activity that the type of movement that you'll be doing within the app. The number 3 is the screen where you'll have the information. So in this case, it's showing that you have to start scanning. To press start scan, that the system is ready. If you already did the scan, it will appear the 3D model of the socket in there. And then on bottom, the actual actions for each of the features on the left. Next slide. So if you press the scanning button, you will get a pop-up window where it will appear all the scanners on your network. You select the scanner that you're using by pressing it and press start scan. And it will start scanning. Once this process takes about 3 minutes, 90 seconds for the actual physical scanning, and then about 90 seconds to process, depending on the number of images that were used and that is related to the size of the socket itself. Once the scanning is complete, you'll get the 3D model on the app screen. Next slide. So besides the scanning action, and you can do these actions while you're waiting for the scan to complete, you can fulfill the range of motion information. And the data on these tools is automatically saved. So you can just switch from one to the other. Next slide. You can fulfill the patient information like weight, height, and you can add any notes that you want. Next slide. So once you get the scan, the next action is to press the gather data button. Once you press that button, you'll move to the acquisition screen. And there you will have the acquisition list. If you press it, you'll have a list of all the acquisitions you've done with that patient, because you can do a static acquisition, a dynamic acquisition, and even for the dynamic acquisition, you may want to do a 1-minute walk test, a 6-minute walk test, do some stairs and some other activities, and you can save them all on different acquisitions. On the 3, you will see the connected devices. On 4, you will have the ability to choose between static and dynamic analysis. And on the 5, you have once again the 3D model, and it's where you're going to see the pressure information changing. On 6, you have the button to record. So you will be able to see the information in real time without doing anything once you have the sensors plugged in and not everything connected. But if you want to be able to see that information after the appointment, you want also to have the processed result, you need to record that information for about 2 minutes. So once you start the acquisition, it will ask you to choose the devices that you're using. So you'll have to select one main wearable and one smaller wearable, the IMU, and press start once you've selected them. You press connect and you'll have the sensor information immediately appearing. Yeah. So here you see immediately the information in real time. You choose if you want static or dynamic. You press record. You gather the information for as long as you want, and you then press again on the record, stop recording. You will get a pop-up to do the name and save the information. So the important here, just try to explain, the static analysis is usually when you want to get the patient to stand upright for a certain amount of time and see how statically, when he's stopped and static, how that information, the pressure looks like. Then you can label it, it immediately gets labeled as a static analysis. If you're doing a dynamic one, on the next slide, you'll have a lot more information. So because besides collecting pressure information, the system will also be collecting the gate information. And after processing the results, you'll have an average pressure for each of the gate stages, either loading response, mid stance, terminal stance, pre-swing and swing, and also an average stride, or even the unprocessed results. So you'll be able to see a video of the pressures changing in the socket, synchronized with a 3D model animation of the amputee walking. And I'll show you all of these on the actual app with results that we already gathered. Next slide. So as I said, you can have multiple acquisitions for each session and for each patient. Next slide. And then when you're reviewing an entry after you already have the processed result, you can check any entry of any time whenever you want. As I said, you will have the list of acquisitions. Once again, you'll have the mode of data visualization where you can choose between the processed results, that is the average pressure for each gate phase, the average stride, that will be an average stride calculated from all the strides within the analysis that was recorded, and the unprocessed results, that will be an animation of the pressure changing with synchronized with an animation of the amputee walking. And then you have the acquisition options where you have some other tools like the possibility to export the 3D model, to measure the perimeter of the socket, automatically generate a report, or consulting information about the patient. So this is an example of the processed information where you can see the average, in this case, for the loading response of this patient. Next slide. The average stride. So you'll have a sliding bar where you can slide between the different stages, and also the possibility of reproduce the video automatically with different speeds. And then the unprocessed results, where you'll have the animation on the right side synchronized with the pressure information changing. You can use the scroll function to scroll throughout the data that you gathered, or you can reproduce it at different speeds. You'll also see an arrow on the bottom of the 3D model, the 3D animation of the amputee. That means that the amputee is turning. Or if he stops, he's actually stopped in that position. Next slide. To export the 3D model is very easy. You just press the forward button and you can either email a snapshot of the model in the position that you're seeing it, or export the STL, and it will be emailed to the email that you registered on the app automatically. Next slide. generate a report, you just press the report button and you'll immediately get the report with all the patient information, the range of motion information, different points of view of all the 3D model for all the gait phases, and on the bottom, any notes that you've made and any pictures that you've taken of the amputee's limb. So that's pretty much it. So I think I'll do a complete demo of the system, and on that demo I will be sharing the screen of the app, and that will allow you to see exactly all the functions that I've been showing you until now on the app. Okay, let's share the iPad screen. So I think you all can see the screen right now, and you should also be able to see the video, my video as well.
Yeah, we've got it, Fred.
Okay, so basically, as I told you, the first step is to get the socket. You verify if the strip, first of all, you verify if the strips that you choose the type of strips that you'll be using. So for example, in this socket, I'm going to use 2 strips of 8, 1 on each side, and 2 of 4, 1 on the back and 1 on the front. I'm going to connect the strips to the wearable, turn on the wearable, connect the strips just to see if they are good to go. So only blinked once means that it's okay to use. I'm going to place the strips in the socket. You just place them in the position that you want, press them against the sides, be careful around the edge to make sure that you don't get any artifacts, and it's done. So I will not place all the strips because I already prepared one socket with the strips connected. So here you go, it's this one. As I said, I'm using 4 strips in this, and I'm going to place then the socket with the strips inside the scanner. So place the socket inside the scanner, you close the gripper, and you have it in the proper position. Then close the door, and we move on to the app. So here on the app, if we can create a new patient, for example. So just choose the name, use my name, for example. Gender on the bottom here, and any birth date, doesn't matter. So you just press something, press save, and you have a new patient created here. Then you go here on the plus on the right side and add a new entry, select the type of entry, so right leg below the knee, and press start. You'll have here the actions on the left side. You can press scan, and you'll have the scan that is available on the network. For example, if I open the door and I make a refresh and I try to scan, it will tell me that the door is open. So it won't allow me to select the scanner. I'll close the door. The light changes to ready to scan. I'll press scan. Sometimes it takes a bit to refresh. You select the scanner and press connect. And you'll hear a noise in the background that is the scanning start. So as I said, this process takes up to 3 minutes because the physical part is 90 seconds, then the processing is up to 90 seconds depending on the speed of the internet and the size of the socket. While it's doing this, you can fulfill the range of motion information. All this is sliding, so it's very easy to use. You can fulfill patient information once again, all sliding, so you just put any information you want. You want to add notes, you just press it and write any notes that you want. And you can also take pictures from anything that you want to add to the process. I already did the scan, so we don't have to wait. So we just press cancel scan. I'm going not to save this. So if I came here to this, to this one, for example, as you can see, we have an incomplete entry. That means that there is an entry where we only have the 3D model, and I have two completes where I know that I have some information about the pressure. If I press the history button, for example, I'll have here the progress report of the history. Some of the fields are empty because I did not place that information here. And you can see it by appointment, or you can see the actual history variation of patient information, weight, height, and any range of motion information. And you can export this information very easily by email as well. So if we go into this appointment, for example, we have what, as I showed you, the review screen. So here you'll have on the left top corner, you have the appointments. In this case, for these, the recordings, we only have one for this specific appointment. And we have here the 3D model. So right now we are on the screen of the processed results. So we are, it's the average for each gait phase. You can change it by just pressing the phase. We then have the screen of the average stride, where you can scroll through the stride and the different stages of the gait and see how the pressures change, or you can reproduce it at different speeds. And then you have the unprocessed results. And this is very similar to what you would be seeing in real time. But this allows you to see it after and try to get to think about the information with more detail. Or this is very important also to show it to the actual patient where you're explaining what might be happening in the socket. So you can just reproduce it. You'll see that the 3D figure will start walking, and this is synchronized between the pressure and the animation. So the arrow means it's turning. And while you're seeing the video, you can change the view of the socket. You can zoom in, zoom out, and you'll have all the information. So then, besides seeing this, you can, as I said, you can scroll through the process. You have the direction of the turn as well. And if you then press, for example, export, you can, as I said, you have the possibility to email the snapshot of this particular case or the 3D model in an STL file. You can press measure and you have possibility of seeing the perimeters where you have the marks. And you can export the report. So you can see it automatically generates a report with the different views for the different gait phases. And in the end, it would have notes and pictures if we add some. And then you can have the weight, the height, and all the other information, and you can export it, and it will just send it to the email of the user very easily. Let's go back. So I think that's pretty much it. We've been through all the process. Then you can now remove the socket from the scanner, and if you wanted to move on to the acquisition, just get the wearable around the socket facing the outside, press it against the socket, and then you just connect the strips into each place, turn on the devices, and you're good to go. In this case, you would add a new analysis. I can show you as well. Just come here, for example, add a new acquisition. The wearables will appear here on the list. You have to select one of the larger, one of the smaller ones, connect, and you would be ready to go. So you could use the wearable and can see the pressure information changing as I press against the sensors in real time. So change the view. Yeah, here you go. I think that's pretty much it.
Great, thanks, Fred. So I guess that what we're going to do now is obviously open up to everybody for questions. So Fred, if you were able just to drop out your screen share, that would be great. And we obviously are open to the floor now. Just bear with me just while I get my questionnaire panel up.
Right, can you change the range of that color coding system? So on the demo, we were seeing, all the colors from green to red. And I'm just wondering if you're able to change the scale to make the red a higher pressure, a higher relative pressure. Obviously, some ambulators create greater forces when they're doing greater levels of activity. So is that a sliding scale that you can change that relative pressure?
So we can't manually change the pressure, but that pressure is adjusted for each patient. So the red you're seeing with one patient is not the same red you're seeing with a different patient. So it's always relative to that analysis that you're doing. So it's an automatic sliding scale, let's say.
Okay.
So
great. Very interesting.
Great.
Thanks for your question, Mike.
Yeah.
Cool. Thank you. Anybody else got any questions that they would like to ask us?
Phil, I don't know if I'm still muted or not. You still got me?
Yeah, we've got you.
Okay. We were seeing that all of those pads were kind of oriented in the socket in a relatively uniform manner in 4 places across the socket. Sometimes patients will just indicate that they're having pressure somewhere vaguely on like a medial or lateral side. Is it possible to just place all 4 sensors in a row to kind of cover a whole surface area, let's just say on the lateral aspect of a socket?
yeah, you can do that. We usually advise to have at least one outside the area that you're looking at, so you can have, since it's a relative pressure, you want to have like a reference. So you should always have something outside the area of interest. And then, but you can, for example, have 1 on the opposite side and 3 on the lateral, on the side that you want to look at without any problem.
Okay, so
or
at
you,
least
or you can even have
opposing.
Yeah, or you can even have
Okay.
1 on the front, 1 on the back, 1 on the side, and then on the other side you can have 3, for example. So there is no problem with that whatsoever.
Okay. Thank you.
Great. Thank you, Mike. So does anybody else have any other questions at all? We have another 15 minutes before we run this session again today. If you'd like to see Fred do his thing, you're more than welcome. We have another question. This has just come in from somebody just called Cascade Orthopedics. So it says, I apologize if you already answered this, as I had to step away for a moment. How long does it take a new clinician stroke clinic to learn this system and become proficient? So that's question 1 of 3, Fred. How long does it take?
So it really depends on the clinician. We've worked with people that were more we've seen definitely that people that are more used to using iOS technologies and also to use CAD/CAM technologies is very fast to learn. So they get the system in 1 or 2 weeks, depending on how much patients they are doing. If it's someone that is not using technology on a daily basis, they might need a little bit more time to get used to the system. But usually there's not a huge learning curve. I think the step that usually takes more time for people to get is, since it's relative pressure, is fully understand how that relative pressure works. So people tend to look at it and think, oh, this is red, so this means it's bad. And then they need to take a moment and think, No, this just means that I have more pressure here than on another location. So I think that's the step that takes a little bit more time to fully understand. The use of the system itself, it's quite fast because it's very intuitive and very easy.
Thanks, Fred. So you mentioned in the presentation that you can't manage cavities. So does this mean that you have to avoid relief areas or buildups?
No, so you can put sensors in concavities and in relief areas. Just make sure that the markers on the sensors are not in those areas. So just make sure that the markers are visible, because if the markers are visible, the position of the remaining cells of the sensor will be inferred by the algorithm. So it's fine. You can have sensors anywhere, even in concavities or relief areas. We'll get the information, but to make sure that the sensor is detected, those markers need to be visible. So if, for example, you have a concavity on the side that you want to look at, use a longer strip, make sure that the markers are on the bottom to be easily seen, and you'll have all that information without any problem.
Okay, thanks. And then last question, is there a ratio between the pressure? So is there a relative pressure between, let's say red is 4 times the pressure of blue? I mean, how does the balance between ratios on the colors work?
So usually they represent a percentage of the total pressure. So it's not that, it's not always like there is a 4 times amount throughout all the patients that you'll be doing. There is a percentage relation between the total pressure that you have inside the socket and the pressure shown in that particular spot. So it will, the relation between them, it will depend on the number of sensors that you're using, on the pressure that is being felt inside the socket, and on the localized pressure that you will be seeing on other places.
Okay, great, Fred, thank you. I don't believe we have any other questions coming through. So everybody, please feel free just to raise your hand using the system or pose any questions, because we're really here for you today. So, you know, and no question is a stupid question. So please just fire away. Looks like it might be an opportunity for us to get a coffee. Oh no, we have a question here from Alicia. Alicia, would you like to unmute, and you can pose your question directly.
Hi, Phil. I did not have a question, but I did want to. Okay.
Sorry, I think it was Evan. Maybe I think it's, yeah.
Oh yeah, my apologies. Let's.
No worries.
All right, so Evan, over to you.
Yeah, I was just curious if you guys have done any comparisons against check sockets to see if this, like how much time this saves, you know, just versus manually doing it. Are there any studies or anything out like that?
Yeah, we have done an initial trial in Portugal where we saw that we reduced the fitting time by about 50%. When compared to the traditional method that is used right now without this type of system. And we are at the moment using the device in 2 O&P clinics in the States. So we are using it in POA in Middletown and in De La Torre O&P in Pittsburgh. And they are seeing that the main impact for them was that the patient satisfaction really increases, because the patients really like to be able to see and understand what's happening, and the interaction between the prosthetist and the patient improves a lot, and they really understand a lot better what they are doing wrong and why are they feeling discomfort. And we've also seen that by getting the fitting better quicker, we are also increasing the K level of the patient, so the functionality is actually increasing as well.
Yes,
so we have some case studies from these centers that we can share after the call if you'd like.
Yeah,
awesome.
we absolutely do, and I guess that also answers Buzz Hanny's question about do we have the device used in the States. So as Fred mentioned, we have 2 clinics, and we have a 6-patient cohort report, I'd like to say, rather than a detailed outcome study, which is being written up at the moment. But we have 4 of the case studies available on our website, and I believe we are also going to be sharing them with the Cascade team so that they can be formatted into the Cascade corporate style. So that's great. Well, we have another session coming up in 7 minutes. So I don't want to wrap us up too quickly. So I just want to go around and just make sure if there's anybody else has any other questions before we wrap us up today. Okay. Well, I think just for expediency, I'll leave it there. And obviously, if you have any questions, please feel free to email us, and we'll obviously manage those offline for you. So thanks very much, Fred, for all your hard work today. Time to go and do a bit of a throat gargle and get ready for session 2. And thanks very much for joining us today, everybody.
Okay, thank you very much, everyone.
Thank you. Bye.
Bye.